So yeah, thank you very much. I mean, the work that I really did as part of the Masknerd, which is really focused on science communication of respirators, was really driven really about, how do we make masks better? How do we tackle a pandemic? So I'm excited to talk about what the future can hold for us. I do want one caveat that we are now in the future. So we don't even talk about surgical masks. So when I say masks, we're talking about the far better designs that are out there. So this is the colloquial term that we're going to all use in the future. So just to provide some clarity, we now exist in the future. So masks work. And I think one of the important things is that we also have to think about in the future that mask studies need work as well. So how do we improve in our study and design? And so when we think about the future of mask studies, we have to think beyond what we've traditionally done. And traditionally, we've done a lot of style tests studies that are classic prevalence studies. So here's an example of some data that I had put together from a study that had looked at the students in an Austrian school in which a portion of the students wore FFP2 masks and a portion of them did not. And if we look at a classic prevalence study where at time 0, some students started at this rough rate of cumulative rate of infection, and then 8 months later, we see that the students that were wearing an FFP2 mask over that period of time only saw really a 16% reduction. And that's because of how I took that study. But actually how that study was done is kind of how we need to do studies in the future. And that study, when they looked at the Austrian students, actually did a little differently than how I kind of showed that data. And if we instead of just looking at prevalence of what the start and end goal is, if we look about how cases spread, that tells us a lot more. So in this study, they actually did twice weekly PCR and rapid antigen, where one set of students were FFP2 almost all the time, and some other students only had limited use of them. And what they found during that duration of study, especially during the peak of the Omicron, that it wasn't 16%, but actually during the peak of Omicron, there was a 2.2x reduction in the rate of SARS-CoV-2 infections. And that gap closed only because the second group stopped wearing masks because of the government changed the requirements of when FFP2s need to be worn. So it's kind of quite interesting study. And it again highlights that when we think about the futures of studies, when we look at masks, we have to think about frequent PCR testing, not just when you're symptomatic, to really understand the rate of transmission happening. We think things like genetic sequencing for transmission chains. So we understand who was infected by whom. This is important for healthcare acquired infections. We also need specific details given to the users about how and when to use a respirator for a study, and the subjects need to understand that. And really, I think the most important thing is that in future studies, right, in the future, that fundamental design considerations for airborne transmission have to be baked into the study itself. So a classic example, there's a recent N95 study. They're only required to wear them when they were less than 3 feet from a symptomatic patient. Clearly, we all understand that airborne transmission can happen far from that. And so, of course, that study didn't find a significant improvement with N95. So hopefully in the future, the studies are really designed to tackle how transmission really happens. Okay, so masks work, but masks are work. And that is that when we think about masks, there are work on the individual side of things like cost, things like design and comfort and acceptance that's happening at the individual level. So when we think about design considerations, right, we think about how does it fit on your face, how is it comfortable, and is it ease of use? And the classic example is a healthcare worker. These came out of the pandemic after weeks of wearing masks. They have sores and stuff like that. So clearly in the future, we need to consider design comfort and duration of wear. We also need to think about general public and non-occupational settings. Barry kind of hit on this a lot, that there's a lot of use cases that don't exist in that, but that also means that we expand to the general public, which means a variety of racial groups. We also need to include the elderly and the children who are not considered in respiratory standards at the moment. There's also the issue associated with social stigma and aesthetics that come at a cost to the wearer. So some people may feel ostracized wearing a mask. And so we need to transition masks to be just a common fashion accessory. If we think of one most common medically worn device that we all wear, glasses. In fact, some people wear glasses even if they don't need them, right? We need masks to be at that social acceptance, which means they need to be part of their fashion and then look cool. The other important aspect is that they require training and tools to measure the fit of the mask. So fit is a very important aspect of respirators, which means that we need low cost and widely available fit testers. This is something we're working on at OpenAeros. But if you think about the ubiquitous of, at least here in the US, of blood pressure monitors, they're available in grocery stores and pharmacies all over the world. You can just go up. So really what we need to think about is in the future is the ubiquity of fit testers so that you can go to a grocery store or a pharmacy or to your fire department and have a performance measurement done on your respirator. And one of the most important things also is availability. So if there's a huge equity issue associated with this, that the groups that were most impacted by the pandemic, the elderly, the brown and black populations of the US, were most impacted by that and had the least access to that protection. And so that in the future will need to be resolved. Okay, so masks work, but mask standards need work. So when we think about a general public mask standard, we need it not tied to occupational use. And we think about it, masks are designed to standards, and the current standards that we have are really designed to a specific group of people who, again, weren't most impacted by the pandemic. And so we need those standards to better represent the individuals who will be wearing these masks, and that means to cover a huge range of the population. We also need more size, and that drives more size and design considerations. So we need a huge range of sizes that fit different individuals. And we also need to make sure manufacturers measure the performance of their fit on the design. So we don't just make designs, but we actually ensure that they do actually fit the population that they're targeting. And I think that's very critical. And then the last one is considerations for the duration of use and specific use cases, such as wildfire smoke versus a bioaerosol that kind of Barry was talking about. There can be different design requirements for different types of situations that we need to breathe in. But I think the key things that will come from that is that they need to be easy to breathe in, and they will need a variety of attachment styles, not just headbands, not just ear loops, or whatever the future holds in that space. So masks work, and so does infrastructure. And so masks help complement almost every situation. So on the right is a plot that was done looking at a large office building and doing a calculation in terms of transmission that might happen in that space of a large office building that had 133 people inside of it. The black dotted line represents an R0 of 0. What we really want to drive in indoor spaces is get transmission low enough that it's less than a R0 of 1, meaning that, well, one individual lead comes in infected and less than one individual would transmit in that space. And if you do that across every building and space, then we have stopped the pandemic. And what we find in this study is that the light blue plots are different tools to improve the HVAC or to the filtration or adding portable air cleaners or a UV. And what we find is that when you add masking on top of that, masking with any combination of those gets that R0 below 1, which is very critical. And so they're really a complement to do things. So what mask wearing does is buy us time to implement the collective changes that we need as a society, which are those infrastructure upgrades and all of the other things that go with masking. That also, when we stop relying so heavily on masking, helps remove the individual burden. It makes space more equitable for all the people that are there, the disabled, the immunocompromised, the immunosuppressed. So we need to make spaces accessible for all individuals. And really, I want to highlight that we really have the tools today. Between testing and air cleaning and UV, we really can actually get that R0 below 1 for a variety of tools, and masks can just be an accessory on top of that and help with that. So masks work and will continue to work best in certain scenarios. So in the future, we will still probably be using masks in a lot of spaces. And these are spaces that are impractical or difficult to make safe in terms of spread of infectious disease. So some of these places that we think about today, many healthcare scenarios where we have people who are known sick coming into an ER, we can use it for source control. We want to make sure that if you're coming in for healthcare, you're not going to get an infection from another people. So we can use it for source control protection for patients. And you can also think about dental and dental hygienists, right? They're very close to your face. They're doing a lot of work in there. Stadiums, they're impractical to make if they're enclosed, like we have here in Minneapolis. They're very difficult to probably make below that R0 of 1, given the density. Travel and planes, likely to remain useful in that space, especially no one wants to get sick on their trip. Also historic venues where it's impossible or very difficult to make the infrastructure changes necessary to update it for that. And lastly, probably one of the more interesting ones is public restrooms. I think there's a lot of interesting discussion about how toilets aerosolize the things that were in them. And I think that conversation will happen in the future as well. So masks work. And what we really can do is we can use them as a tool to help build the future, to enable all of the things in society that we need to fix so that in the future of 10 years from now, we're not talking about really the pandemics anymore, or at least we have a lot of the biosecurity issues tackled. And so I think that that's where I see masks in their as part of a tool to building the future for pandemic resilience.